Good evening, I'm Grissom, and welcome to our live coronavirus pandemic special report. Tonight we have a doctor from Cohen Children's Medical Center to help you sort through what's going on with COVID-19 in our communities and across the region. And we always want to hear from you. This is a call-in show, so call in 516-393-1800. All right, let's get right to it. No more pencils and no more books, because Governor Cuomo today announced schools and colleges statewide will be closed for the rest of the academic year. Now, he says he doesn't think it's possible to even reopen schools in the way that would actually keep the children, students, and the educators all safe. And there are still, on average, 1,000 new COVID cases every day. Let that sink in. 1,000 a day. The governor says he wants to dig deeper to find out more specifics on those cases and where they're coming from. Are they coming from work or people at home? Now, there are now more than 308,000 confirmed positive cases in the state, more than 70,000 of those right here in Long Island. And today is the first time the state's one-day death toll fell below 300 since March 30th. That's still staggering. Across the state, the pandemic has claimed 18,600 lives. Right here in Long Island, more than 2,900 people are dead. But there is a glimmer of hope we're hearing. Today, County Executive Laura Cohen announced the 16th straight day of decreased COVID hospitalizations, and Suffolk Executive Steve Bellone says hospitalizations in his county, well, they continue to be on the decline as well. All right, let's get to our discussion right now. Joining us tonight, Dr. James Schneider, the Chief of Pediatric Critical Care Medicine at Cohen Children's Medical Center. Thank you so much. I want to thank you on behalf of News 12, on behalf of all of Long Island. You're one of the people on the front line, so we thank you for everything you do every day. Let me start off by asking you, how are you holding up?
I appreciate the opportunity to be on the show tonight. I'm doing okay. You know, we've been busy. We're taking care of both the pediatric ICU and the adult ICU. We're helping out, but you know, I have 2 young kids, so homeschooling is challenging, but we're doing okay. I appreciate you asking.
Yeah, no, I'm in the same boat with the homeschooling part. Yeah, we're all kind of in that boat. A lot of people may not realize this, but Cohen Children's, especially in the pediatric unit, the ICU, you treat at least the same percentage, if not the highest percentage in the nation of minors, right?
Right. Yeah, we've actually been very busy. You know, I think it's an important message to send that we know COVID-19 is clearly hits adults fairly aggressively, and but it's important to understand that children are being affected. You know, our hospital, we've seen over at least 70 children already in the entire hospital, and in our ICU, we've already seen probably about 10% of the country's entire inpatients of ICU COVID patients. So it's been a real challenge. We've had some really sick kids, had some great wins, some successes, but this is not an adult disease only, for sure.
Now, when we're hearing more and more about this treatment, remdesivir, does that work the same with children as adults?
Well, remdesivir, we have to remember, it's still an investigational drug. You know, I think we're all encouraged by some of the results, but they're really preliminary. You know, we've been using it. I've had plenty of experience myself and my colleagues. I've been using it at LIJ in adults, perhaps, and also we've used it a little bit in children. And it's compassionate use, we call it, in kids, because we don't even know yet if it works. So we're hopeful, but by no means are any of us on the front lines considering this a magic bullet. Okay,
well, we keep our fingers crossed with everything in all the patients. Let's get to the phones right now. Kim from West Islip. Kim, are you there?
I'm here.
Oh, thanks for calling, and what's your question?
Good evening, doctor. So my thing is, my daughter, her fiance, and 4 of his family members had all contracted the coronavirus, and they all live in the same home. Hopefully, rather thankfully, they fully recovered from it. It's been about 3 weeks since they're free from the virus. My question is, my daughter and her fiance have a 5-month-old son who's not shown any signs or symptoms being around them. Could the baby be asymptomatic and a carrier of the virus?
So it's a great question, Kim, and I appreciate the question, because what we know is that there's a significant percentage of patients who actually have the infection but are asymptomatic, and that's really the crux of why social distancing, for example, is so important, because many of us maybe walking around the community have no idea we even have it, but are still infectious. And so it's possible that the 5-month-old has the infection, but as long as there are no symptoms, there's nothing to worry about.
And doctor, you can speak to this because I see this just in reporting on this every day. There seems to be confusion out there among some people with the masks and wearing the mask. They think that, well, I'm healthy, so I don't need the mask. That's really just to protect the other person, isn't it?
It's a great point. It's a really important point. If I could put exclamations on it, I would. The purpose of the mask is primarily to prevent myself or the mask wearer from spreading the virus rather than protect you from getting the virus. So just because you feel healthy, you have no symptoms, there still is no reason not to be wearing a mask if you're out in public settings.
Okay. Rosemarie from North Massapequa, you there? Rosemarie, you there?
Yes, I'm here.
What's your question tonight?
Yes, good evening. Does the doctor feel that the virus may mutate or change over the summer and perhaps a lot more strong in the fall?
So it's another great question. It's hard to say for sure whether it will or will not. We know that some viruses do mutate, if you will, and change a little bit. My understanding is I've seen a little bit of data that suggests there may already have been a little bit of mutation going on in different serotypes, which makes it difficult to create vaccines. So I think the other part of the question really, are we going to see a resurgence in the fall or winter? I think most of us in the field believe we will, whether or not that's due to a mutation of the virus or just enough of us who made it through this season and the summer having not been infected and therefore get infected again. So I think data will emerge. We'll find out if it's mutating. It very likely will. But I think the risk of resurgence in the fall and winter is very, very likely.
Yeah, something not to look forward to. All right. Let's go to Frank in Baldwin. Frank, you there?
Yeah, I am.
What's your question tonight?
Yeah, I was just wondering if they were going to open up the public swimming pools for Nassau County this year.
Well, I don't know if the doctor, that's more of a policy question. I'm sure the executives might, but the doctor, would it be smart to have pools open in the summertime?
So it's another great question. I appreciate the fact that, yes, I'll let the policymakers decide whether to open the pools or not. But I think, one of the questions that comes up, are pools going to be safe because they have chlorine in them? Will that prevent spread of the virus? We don't really know. There's no evidence. If you look at the CDC website, there's no evidence that there is spread within pools, saunas, hot tubs, things like that because of chlorine. However, when you're at a pool, you're also next to people, you're also close to people when you're not in the water itself. So I would consider a pool just a same type of environment as any other social distancing environment. So, but again, I think the decision to open or close pools, I'll leave it to the policymakers.
Right. Doctor, let me ask you this. I've heard and I read that the virus, at least in adult, it seems to have more severe symptoms with males than females. Is that also true? Are you seeing that with with minors, with the kids?
It's another great question, for sure. So just to emphasize what you said, we are seeing a more severe illness in male adults. However, women are not spared for sure. Whether the data are, since there are not nearly as many kids, it's hard to know still. And also you have to imagine a 2-week-old is probably different than a 17-year-old, and we're all lumping them together in the category of pediatrics. So I think data will eventually emerge, and we'll get a better sense to that.
And what kind of symptoms are you seeing with the kids? I mean, I know you can't talk about specific cases, but what generally with the kids? Are they showing the same symptoms as adults?
So they may. So the answer is they can. So commonly we've seen the typical febrile illness for a few days, then breathing symptoms, respiratory symptoms, cold, cough, and then turn to pneumonias and can be severe pneumonias needing ventilators. However, we're seeing lots of different presentations as well, some of which are very random. So I think mostly what we've seen now is because of the variety of presentations, we're really having a much lower threshold to checking for COVID, and most kids who show up to a hospital at this point, when they get admitted, we'll check for it. We've been surprised by certain presentations.
Okay, let's go to Jay from Northport. Jay, you there?
Yes, I am.
What's your question tonight?
Well, first of all, I just want to say thank you, Dr. Schneider, for all you're doing.
I appreciate it.
Secondly, I'm sure we're all aware of the fact that there are expiration dates on food and pharmaceuticals and things that involve our biology. I heard somewhere that that these masks that are being distributed also have expiration dates. And my question is, how would they determine what an expiration date would be on an inanimate object such as a mask?
That's a great question.
Actually, Doctor, let me take a real quick break. Squeeze in a break here. I'm going to let you answer that question right after the break, and we'll be right back. We're going to have more expert advice on how to keep you and your family safe from the coronavirus. And remember, we do want to hear from you. Call us now with your questions. That number is right there on the bottom of your screen, 516-393-1800. Don't go anywhere. We'll be right back. Welcome back to our live coronavirus pandemic special report. Let's bring back in Dr. James Schneider, the Chief of Pediatric Critical Care Medicine at Cohen Children's Medical Center. Again, thank you for your time tonight. Before the break, Jay from Northport was asking about masks and whether they really have any expiration dates on them.
Right, if I may, I think you're referring to probably the N95 masks, perhaps. They do have, when they're made, there is an expiration date put on them. And it's just for the integrity really of all the components of the mask, because it's important that the mask creates a good seal around your face when you're using the N95, which requires both the mask itself, the plastic or the rubber straps to go around the back, and those do have a shelf life known for whatever they're made of, and I'll leave that to the manufacturer. So I think if otherwise you're talking about other regular masks, you can actually make any type of mask with any kind of cloth covering over the face when you're out in public. So I think it's important that you follow the expiration date on the N95 if you're using it, and otherwise have a mask of any other sort that's going to protect yourself and really protect, again, the others out there.
Is it possible to wear a mask for too long if you're outside, and let's say you're out for 8 hours? Is that too long to wear a mask and keep it on?
Really, the duration of the mask is determined by if it gets soiled or not. So if you're wearing it by yourself, you're not in the healthcare setting, for example, where it may get soiled by another patient's body fluids, saliva, things like that, then it's okay to wear that same mask. And I would suggest washing it, particularly if it's the one you make out of cloth, for example. I know Sanjay Gupta has shown us how to make masks, for example, out of handkerchiefs, and so I'd wash it every day. It makes good sense.
Okay. Let's go back to the phones. Jerry from Farmingdale. Jerry, you there?
Yes, I am.
What's your question tonight?
My question is, since the virus lingers in the air, is it safe to eat in the backyard with a friend who works in the nursing home?
So it's another good question. I think, we talk about the 6-foot distance that's required to maintain between ourselves in social distancing. And I think if you're going to be with people who may already be positive, and I assume you're referring to a positive infected patient, you want to always maintain minimum 6 feet distance. I don't know of any data that will show that with wind, for example, if those particles can travel farther than that 6-foot distance. But most importantly, maintain a minimum 6 feet no matter where you are, whether it's outdoors or indoors.
Okay. How about Warren from Lawrence? Warren?
Yes, I had a harrowing experience yesterday afternoon shopping at Stop and Shop. I find that none of these shoppers are doing social distancing. No one's observing the direction arrows. They are coming right by me, beside me, next to me, on the shelves, within 1 to 3 feet of me. Staff members, too, you ask a question, it comes up nose to nose to you, and I don't even know if the staff was wearing masks.
Oh, okay. Is that? Go ahead. What's your question?
I got home yesterday. I was really shaken up if I could have been contracted coronavirus from going to the supermarket like this.
Okay, and your question for the doctor?
Is this a serious or realistic concern about people not social distancing at the supermarket, and is this a likely way of contracting coronavirus?
So I'll say that, what we've seen now over the last few weeks, particularly more recently, that data is getting reassuring that we're starting to see fewer cases, although we're still seeing too many. And that is, I think, all a result of the social distancing. So we still have a long way to go, though, which is really important to remember. So yes, by being 1 or 2 feet from each other, whether you're in a grocery store, whether you're in a movie theater or a beauty salon, those are all good ways to catch COVID. And therefore, I think we still need to maintain a very high vigilance in maintaining that social distancing no matter where we are.
Okay. Let's try to squeeze Jim in. Jim, are you there?
Thank you, Richard, for taking my call. I'm asking the doctor, if they come up with a virus, which we hope they will, how will they decide what's the effective way to disperse it, who should get it, and how effective will they need to be percentage-wise of the people that they think should be vaccinated against it?
So you're referring to if we come up with an effective vaccine, is that correct?
Right. I'm just saying if they came up with an effective vaccine, how would they sort that out?
Sure. Well, that's, the FDA does a really good job, and the CDC does a good job of creating all vaccines, and I'll use the flu vaccine as the example, that once a flu vaccine is determined to be effective, and there are methodologies and testing that goes into that, and once it's determined to be effective, then I'm hoping that we're going to see a community-wide availability of the vaccine, because I think, quite frankly, until we have a community-wide vaccine, we're not going to really see a significant decrease to the point of where we can get back to normal. So that will be something that we'll have to see as data emerge through the CDC, through the FDA, and hopefully all of our personal physicians in the office will have these available to give to us.
Is it realistic to even think that we're going to have a vaccine this year?
This year, meaning 2020?
Yeah.
I would think it's probably a little premature. I think the best we've seen, and I guess we got some data yesterday, some suggestion from the administration that hopefully by the turn of the calendar year we'll have a vaccine that's ready enough just to start testing. So I think before it's widespread, we have a long way to go.
Unfortunately, that's all the time we have. Dr. Schneider, thank you so much for everything you do. Thank you, and we'll see you.